Good evening. My name is Brandi Hill, and my topic is birth control lawsuits. My main claim is lawsuits being filed against producers of birth control Yaz and Yasmin have a negative effect on women. Yaz and Yasmin are oral contraceptives, which is a form of birth control containing the progestin drospirenone in them. Drospirenone is an ingredient used to treat the symptoms of PMDD, or premenstrual dysphoric disorder. The justification of this claim is that harm posed by the use of these pills is less than the harm caused by unwanted pregnancy. As of mid-February, about 1,100 lawsuits had been filed in the United States against Bayer, which stands behind the safety of the pills, reports the LA Times on April 19, 2010. My first claim is birth control lawsuits are based off of small amounts of research that is not enough to reach a conclusion. Contraceptives such as Yaz and Yasmin and the generic brand Acela stop ovulation with measured doses of estrogen. These products have been continuously backed by Bayer, despite the negative press. Research was done by the company Bayer, and the product has been deemed safe and effective when used according to the product labeling, according to Rose Talarico, Deputy Director of External Product Communications for Bayer. In a test done by Bayer, conducted by the Center for Epidemiology and Health Research in Berlin, studied 58,000 women who were all prescribed various brands of birth control pills. The results concluded that women taking the pills containing drospirenone had no greater risk of mortality, cancer, or cardiovascular issues than women taking other brands of birth control. In another test done by the I3 Drug Safety Company, they tracked for 7 months about 70,000 women in the United States taking various kinds of oral contraceptives, including ones containing drospirenone. They came to the conclusion that more than 9,000 women would need to take Yaz or Yasmin for one case of deep vein thrombosis or blood clots to occur. Yet another factor that has gone unexplored is whether the women in these studies are smokers or not. Women's Health states nicotine causes high blood pressure and increased heart rate. This puts extra stress on the blood vessels when a woman is on the pill. This adds even more stress to the blood vessels because of the extra estrogen. This can lead to higher chances of blood clots and other heart issues. Dr. Anitra Beasley, a physician at the Leadership Training Academy of Physicians for Reproductive Choice and Health, told the LA Times, "We've got great news from the FDA that has looked at all the studies and assures us that the best done study shows that the risk of clots with Yaz is not greater than on any other birth control pill." My second claim is that birth control sales were dominated by Yaz, making up 44% of sales of contraceptives in 2009 due to them being highly effective. These products were very popular before these lawsuits were filed. Bayer received a warning from the FDA telling them that their advertisements were overstating the effectiveness of Yaz for treating PMDD. The company immediately altered their marketing and advertising strategies to meet the standards of the FDA, stated by Seance and Kurtz. The official Yaz website states that Yaz treats anger, irritability, markedly depressed moods, feeling anxious, bloating, change in appetite, headaches, and muscle aches. It is also said to treat moderate acne. The website also clearly states that it is not meant to treat symptoms of premenstrual syndrome or PMS. My third and last claim is birth control lawsuits have negatively affected women who are taking oral contraceptives. Patients get hurt with these types of lawsuits. They get scared not only with this one pill, but all types of contraceptives, states Dr. Andrew Conitz, a professor of obstetrics and gynecology at the University of Florida's College of Medicine. Conitz said all oral contraceptives higher the risk of blood clots 3 to 4-fold, and pregnancy increases the risk of blood clots 6 to 10-fold. He said he wouldn't recommend patients changing their pills if Yaz or Yasmin are working well for them. Dr. Anitra Beasley has been telling her patients the same thing. She said many come into her office with worries after seeing commercials, questioning the pill's safety, and that some have stopped taking Yaz only to come back with an unwanted pregnancy. A pregnancy can be ruinous to a woman's life if it is not planned and wanted at the time. Stopping the use of contraceptives due to being scared from lawsuits claiming alleged harm without further proof should not be the reason for unplanned pregnancies. But since the filing of these lawsuits has started, this has sadly been the case. To review, my 3 claims were: birth control lawsuits are based off of small amounts of research that is not enough to reach a conclusion. 2, birth control sales were dominated by Yaz, making up 44% of sales of contraceptives in 2009 due to them being very effective. And 3, birth control lawsuits have negatively affected women who are taking oral contraceptives. In conclusion, lawsuits being filed against producers of the birth control Yaz and Yasmin have a negative effect on women. Thank you.
All right, the proposition is clearly stated. I think you need more of a preview than you have. You did signpost the claims once you got to them, although it was a little confusing on the first point when you got to the smoking issue, because I thought that that was a secondary claim and it was really just something that was part of that first claim. Your second claim is basically just descriptive data. There's not really any inference there, so it could probably be background information. It doesn't advance the proposition. Unless you have some information showing, quantifying the amount of drop in usage of the product, then I think you could put that together with that point and make an inference there, but right now it doesn't have that. You did a pretty good job citing your sources, and you had a variety of information. You are using the manufacturer's study to support your conclusion. One of the things I think you need to do is maybe have a little bit stronger attack on some of the negative studies that have been cited. Your claims are largely qualified. You're pretty careful about putting them in a context, so I think that helps make your argument stronger. It seems like a little bit like you're rushing during the presentation, and I think you can pace yourself more effectively. All right, thank you.